Mary Uglini here for Rebel News on more modeling and simulation studies being hailed by government agency as having saved us all. Recently, the Public Health Agency of Canada published a pretend play simulation titled Counterfactuals of Effects of Vaccination and Public Health Measures on COVID-19 Cases in Canada. What could have happened? Where they fantasized that up to 800,000 deaths were prevented by their public health measures, along with other counterfactuals or things that never happened. This prompted several medical professionals from the Canadian COVID Care Alliance, which is an alliance of independent scientists, doctors, and healthcare professionals, to denounce the claims using logic and scientific rationale. The authors included Dr. John Hardy, who is the former head of dentistry at Ottawa Civic Hospital and Vancouver General Hospital, Dr. David Vickers, a statistical associate and epidemiologist with the Centre for Health Informatics at the University of Calgary's Cummings School of Medicine, Dr. Stephen Eberspecher, who is a doctor of chiropractic with experience in clinical research and delivery of evidence-based healthcare in low and middle income countries, Dr. Claudia Chaufin, a professor of health policy and global health at York University, and Dr. Stephen Pellick, who's a professor in the Department of Medicine at the University of British Columbia. Joining me now to elaborate on the author's dissection is Dr. Pellick himself. Let's check it out.
I'm a professor in the Department of Medicine at the University of British Columbia, where I've been on faculty for about 35 years. I'm also the president of Connexus Bioinformatics Corporation, which has been undergoing a clinical study to look at the levels of SARS-CoV-2 antibodies in people who've been infected or been vaccinated. And I'm also associated with the Canadian COVID Care Alliance. I'm the co-chair of the Scientific and Medical Advisory Committee. And I have a PhD in biochemistry, but I've done a lot of research in immunology. I've published about 250 plus scientific papers looking at the regulation of the immune system and also involved in cancer and neurodegenerative disease research. That's my background.
Now, specifically about this Public Health Agency of Canada paper that claims so many lives were saved because of the way that they imposed heavy-handed, unprecedented restrictions and measures onto the Canadian population pretty much indiscriminately. Right. How did they come to this conclusion?
Well, I think they worked backwards, frankly. They were looking for an answer that would justify the rather harsh measures that were taken in view of the threat with the SARS-CoV-2 virus that it posed to the general population. The claim was that up to 800,000 lives were saved. In fact, about 52,000 people died with COVID in Canada, and we now know that number is probably more than half of them died from comorbidities and not actually from the virus. So when you look at the elderly, we had about 80% of the deaths were in people that were over 70 years of age, but 80% of all the deaths were also people that were in nursing homes. So it's unclear that it was necessary to impose all of these policies in order to really reduce the number of deaths. And so when you actually look at those numbers of deaths, if the worst case scenario that they presented a few different scenarios, but their worst case scenario, 800,000, up to 800,000 people dying, that's the equivalent of all the people that died. And this is adjusted per capita, by the way, because we have a smaller population 100 years ago. So that's all the people that died in World War I, all the people that died in the Spanish 1918 influenza, and all the people that died in World War II, they're Canadians, put together. It's just ridiculous. And we now know that the lethality rate of the Spanish 1918 influenza was probably about 100 times greater than actually the SARS-CoV-2 virus for the general population.
Yeah, that infection fatality rate has been a highly controversial, contested subject.
You're claiming that one in every 100 Canadians that would have been infected would have died from this virus. And as we now know in our population, probably over 90% of us actually have been infected with the virus and have not died. Very few.
And so explain a little bit more in depth this graph that was generated by yourself and the co-authors of the response paper that you've shared with me and will share also with our viewers, highlighting what the Public Health Agency of Canada is trying to claim. And also in this really pretend play, fantasized speculation, simulation scenario versus what the hard, concrete, real world historical data shows.
Right. Well, if you see the figure, what you'll notice is that there's little bumps that peak around the second week of January every year. And this is historical. We find that most people die actually in the summer. There's the least number of deaths. And in the winter, especially right after Christmas, we start to have our peak deaths. And when you look at it, it's very consistent throughout. And in fact, it's remained fairly consistent in 2020 and 2021 and 2022. It almost looks exactly the same. But if you extrapolate from their modeling, the peaks are outrageously high. These kind of death rates we've not seen anywhere in the world. And you have to remember that in 2020, there was no vaccine. And yet we actually have no increase in all-cause mortality in the country. The deaths that have occurred from COVID seem to be at the expense of deaths that we would normally see from things like influenza. So we had drops in these other morbidities that were due to those infectious diseases, and they were compensated for. But when you go to 2021 and 2022 especially, now we're actually seeing more all-cause mortality at a time when these vaccines were introduced and were supposed to mitigate this. So in fact, from COVID-19 itself, there's a 39% higher increase in deaths per capita in 2022 than in 2020 when we didn't have the vaccine.
And what were some of the parameters and the modeling impositions, I suppose, for lack of the technical?
One was the assumption that the general case fatality rate, that if you were infected, that 1 in 100, a 1% rate, applied across the board. Whereas we know that, especially now, even with SARS-CoV-2 with the Omicron variants, if you're under 60, the chances of actually dying from it was like 0.006%. So we think that even though the original Wuhan strain, which hit us, which is actually much more virulent than the strains that we have now, more likely to be lethal, I would say in the order of at least fivefold less lethal with the current Omicron strains. They're modeling that this case fatality rate is going to be across the whole country. They're modeling what percentage of people were infected at various stages. I think now it's pretty much appreciated, like I said earlier, that we were seeing, in fact, in our study, 90% of the people that we had tested in 2020 actually had already antibodies against the virus, indicating that they were probably infected. And this work has been published in a paper in JCI Insights back for studies that have done in May of 2020. So their modeling assumes that the public, without their interventions, wouldn't have already practiced self-regulation in terms of if they were sick going out. I mean, if you have a situation where you have numbers and people are told that they're going to be likely to get infected and it has this high death rate, then people respond to that. They don't need to be, government enforcement of their behaviors. So that imposition of certain measures, especially when you're closed businesses and you make it difficult for people to earn their livelihood, this is very stressful. And so in fact, we're seeing part of this increase in all-cause mortality is partly psychological damage, partly damage that's economic to people. And so when you do this modeling, they try to say that, well, these measures protected the lives of Canadians, they've discounted the harms that are actually created by imposing those restrictions or the vaccine itself. And so,
Yeah,
in
and
fact, natural immunity was ignored in the modeling as well.
right, yeah, the complete disregard of natural immunity. But also, I think that part of this simulation scenario is a massive deflection of those unintended consequences that you just ran through there. And so that leads me to question, what are some of the conflicts of interest that could be dissected out of this modeling prediction published by the Public Health Agency of Canada?
Yeah, well, I think you can only look at this and think, okay, you have our chief public health officer, Teresa Tam, is a co-author on a paper that's evaluating what the benefits were from the course of action that they took. So it's rather self-serving. They're kind of like trying to justify these actions. So I see this as much more political. So the original paper got a lot of traction in the mainstream media of how effective the government response was for actually taking on the COVID-19 pandemic. But I think what we're seeing now is that as more information is coming out about that these vaccines are not as efficacious as we were originally told, and in fact may be, in a certain sense, with repeated boosters, may actually be.
Some of the things that Stephen Pellick and I discuss, unfortunately, are not tolerated on certain platforms. And so if you're watching us on one of those platforms, you can scroll down to the description box below, and there will be a link there where you can be redirected to the full report. So I will catch you over on the other side.